All right, so chapter 16, preventing infection. This is the one that I told you I'm going to jump around a little bit on because it goes into a lot of things that we just did with A&P and microbiology. So looking at microbes and so forth and talking about the antibiotics, the big bugs and so forth. So infection itself is a major safety and health hazard. The health team is in charge of helping keep certain practices and procedures to prevent the spread of infection. In infection control, these are practices and procedures that protect the patients, the residents, the visitors, and the staff from infection. Infection itself is the disease state from an invasion or growth of microbes within the body. The people most at risk for infection are going to be infants and the elderly population, and disabled patients as well. A microorganism. This is what we kind of talked about a little bit last week at A&P. It is a small living thing seen only with the microscope, okay? There are good microbes that are like your normal flora in your body that we spoke of. Then there are microbes that are pathogens. If it says pathogen, that means disease. They are disease-causing organisms. And so those pathogens, if they get into places that they're not supposed to be, then they will cause an infection, okay? The non-pathogens usually do not carry infection. These microbes are everywhere, on every single surface, on our skin, deep within our body. They're also in the soil, food, water, every single piece of clothing, animals and furniture as well. The 5 different types of microbes, we studied that last week: bacteria, fungi, protozoa, rickettsiae, and viruses. I'm not going to go into the detail there. Requirements of microbes. These are the things you remember. Requirements in order to keep on living. So they need a host, so that's in a place to live and grow. They like oxygen. They like a warm and dark environment. They grow best at like warm temperatures, so body temperature. They're destroyed by heat and light, so that's why we can take things to like extreme heat temperatures and sterilize them. Or light. I don't know if you guys have ever seen at clinical last year that blinking UV light that someplace used to clean. That's going to kill these microbes as well. There are also certain microbes that are good in some areas, like E. coli. It's natural that it's in your intestines or your colon, okay? But if it enters into the urinary system, then that causes an infection called a UTI. We talked about normal flora. That's your good microbes that keep normalcy going, everything like that. It's when they enter the areas that they are not supposed to, that is when you have a problem. We also talked about that antibiotics are overused, and so therefore it causes these things called multi-drug resistant organisms, or MDROs. These can resist the effects of antibiotics, so antibiotics do not work on them. I call these the big bad bugs, okay? Because even the antibiotics we have cannot take care of them, okay? They're harder to kill. Staph itself, Staphylococcus, or staph infection, is a bacterium normally found in the nose and the skin. It's normal. Remember I said you probably all have MRSA in your nose. You probably all have it on your skin, or staph. But it's when it gets into the wounds or when it gets into a place it's not supposed to that it can cause more serious infections. Enterococcus, that's going to be the E. coli. I just told you that it's normally found in the intestines and the colon, but when it moves to other areas, it causes infections. These infections, or these MDROs that are caused from these overuse of antibiotics, is also another reason is because people don't take their antibiotics for the prescribed amount of time. So like, I feel better after 4 days and just quit taking them. So it really is highly recommend that you finish those antibiotics like the 7 to 10 days that they have of those. The 2 common types of MDROs, so that MRSA that we talked about last week, and then a new one is going to be this vancomycin resistant enterococci. When you see the term vancomycin, that's a high-class antibiotic. That is a big, bad dog, okay? Amoxicillin, the lowest. That's what we all get prescribed all the time, right? Vancomycin is very hard on our veins. It is a good one because it typically treats almost all infections, but there is a vancomycin-resistant enterococci. So what that means is it's resistant. Vancomycin doesn't even cover it. for this bacteria. So it can be really, really hard to treat. An infection itself, again, is a disease state that results in the invasion or growth of microbes within the body. A local infection is in one body part, where a systemic infection involves the whole body. The chain of infection is a process that involves the source, the reservoir, the portal of exit, the portal of entry, the method of transmission, and a susceptible host. So that's going to be the elderly, the infants, the disabled patients. Okay. Also, these animals are transmitting microbes as well. So I say animals, like insects, like ticks, right? Also through food, through water, through eating and drinking, through direct contact. There's a couple kissing on there. Dressing changes, blood and bodily fluids, and coughing and sneezing, of course. What's going to be the main way that we can prevent infection from spreading? The number one way of keeping infection from spreading. You might know, we've already done it in lab. Thank you. Hand washing is the number one way of keeping infection rates down. So, we're talking about infections, and next we're going to move on to these hospital or healthcare associated infections. These infections they start once a patient has received care. So they are healthcare associated or hospital associated. It's because they were there that they got the infection, whether it was a worker, a machine, or something not cleaned correctly, they got it there, okay? Another term for these are nosocomial infections, and insurance companies, they have a heyday with these because you know what? They won't pay for a dime of any of the medical care if the patient has gotten a healthcare associated infection. That means that they're going to make the hospital or the healthcare place pay for that patient's bill, not them. Does that make sense? Because they're like, well, it's your all's fault. You made them get the infection. If they can truly, truly prove that the patient did not have it beforehand, but then has it after they were in the hospital. If they can truly, truly prove it, which happens a lot. But also, hospital or healthcare associated infections can also happen from normal flora. So there's kind of that fine line in there as well. But it also can be transmitted from person to other sources as well. Common sites for hospital-acquired infections are the urinary system. That's from a catheter being put in. The respiratory system. So if patients are on ventilators and they don't get suctioned every 2 hours, or if a nurse doesn't, or a respiratory therapist doesn't follow proper etiquette on the PPE, and maybe they're not wearing gloves while suctioning, and then they go over to the next patient, then their respiratory system could be compromised with infection because of that. Also in wounds, if we're not doing sterile wound dressings and so forth, that could be a reason. And the bloodstream as well. These can be prevented by medical asepsis, which includes hand hygiene, and we're going to go into medical asepsis next. Then surgical asepsis, standard precautions, transmission-based precautions, and the blood-borne pathogen standard. Standard precautions are just precautions that we do every day, like, you know, you put dirty things in the trash can, you wash your hands. Transmission-based precautions, just to quickly summarize it, is going to be those things where there's a big sign on the door and then you have to put on a gown for that, or gloves, or whatever it may be, because they have a specific disease process going on, and you need to wear something to go into that patient's room. Did any of you guys get to put on PPE last year to go into a patient's room? You didn't, Janae? Not even at Pike?
No? I was asked, like, for the people that have, like, COVID or something like that, if I wanted to go in there, they asked me if I wanted to.
Oh, they did? Yeah, they're really, for some reason, the facilities, not me, are saying that you guys can't go in COVID rooms, but if they ask you and then they told you to put on PPE, then they're doing the right thing. Yeah, so, this year, with being at clinical for a total time of about 12 weeks altogether, you're going to have every opportunity to put on PPE, and there's going to be a sign on the door saying, hey, you have to put this on before you enter, and a cart beside it with all the supplies that you need. So, going back up from the beginning here, these are ways to prevent a hospital-acquired infection, is medical asepsis. Okay? Medical asepsis, think about it being kind of like disinfecting wipes. Okay? So, asepsis means being free from disease-producing microbes, where medical asepsis is using a clean technique to remove or destroy pathogens. to prevent pathogens from spreading from one place to another place. So for instance, before I insert an IV into you, I rub an alcohol pad over your skin. What am I doing with that alcohol pad? Cleaning, because I told you you have normal things on your skin all the time, right? But I'm cleaning it and I'm inserting, okay, pretty quickly. So that's going to be typical medical asepsis or clean technique. Now, surgical asepsis takes it one step further. This is what you see when you watch these drama medical series, like the doctors and the nurses scrubbing up to their elbows to go into surgery, and other people helping put on those big gowns. It's more of a sterile technique, and it keeps all items free of microbes a lot better than just the clean technique. So then contamination itself within these techniques is going to be the process of becoming unclean. If you break any of the steps in medical asepsis or surgical asepsis, then contamination is considered at that time. So this picture is really hard to see up here. It's called cross-contamination, and it's showing you a picture. On the first picture on the left there, picture A, she is touching the gentleman there, and on his hands that you can't see are some green little viruses, okay? Some green little spots, and those are supposed to show you viruses. Then she goes and she visits with the patient in the same room next door without washing her hands. Guess what happens? She just spread what he had to the other patient, okay? So this would be considered cross-contamination. Pretty easy method to realize. So, back to medical asepsis here. Sterile means the absence of all microbes, none at all. Okay? Pathogens and non-pathogens. Pathogens are disease-causing, non-pathogens are not. Sterilization is the process of destroying all microbes. Okay? An aseptic practice breaks the chain of infection. You don't have that cycle continuing on and those microbes living anymore. Hand hygiene is going to be the easiest way to break this cycle, okay, and the most important way. Supplies and equipment. So most healthcare supplies now are disposable. So they are single-use items, so after you use them one time, they are typically thrown away. We do not borrow items from another patient and bring them in. When we go room to room with blood pressure machine, we should be wiping the machine down in between with those wipes that the hospital provide, okay? So if it is items that are not disposable, they should be cleaned, disinfected, and sterilized as well. This is a picture of hand washing. Look, she's keeping her hands down, she's scrubbing, then she's rinsing the water while keeping in the downward motion. Then she is drying. Then she turns off the water with a paper towel and is complete, okay? So this medical asepsis is all about disinfection and the process of destroying pathogens. The spores, though, are not destroyed. The only way the spores of the microbes are going to be destroyed is if we use this process called sterilization. And sterilization is going to be in the picture up here. It's kind of a small picture. It's also in your textbook. And it is where they put things in this machine, and they're going to seal it up super tight, like 3 different locks on it, and it is going to get to some like extremely hot temperatures, like thousands of degrees, okay? And that's going to kill all microbes or living organisms, okay? So it does that, and then the machine has to do a cool down process because we couldn't just put our hand back in there and grab them, okay? It has to do a cool down process after so much time, and so this takes time. There's not like a quick sterilization procedure. So, moving on here from medical asepsis to the bloodborne pathogen standard. This is, when it says bloodborne pathogen, these are going to be things that protect the healthcare team from exposure to blood, okay? So, of course, we need to have on gloves when we're drawing blood or sticking for an IV or anything that we might come in to counter, dressing a wound, okay? Of course we do. But there are still chances that you might come into contact with blood. In these circumstances, you could have exposure, just some examples, not all, to HIV and HBV. And these are found in the blood, in our bloodborne pathogens, and exit the body through blood, and so forth, okay? So we want to not spread those things, and so we are going to have an exposure control plan. If something like that happens, we need to have this exposure control plan. We need to identify staff that are at risk for them and educate them and train them on what to do if you do have an exposure. It could be a sharp that dropped or a sharp that you accidentally picked up. It could be in the laundry services that a sharp, like a needle, got accidentally thrown on the bed or something like that. Sounds funny, but it could happen. And then they later on were doing the laundry and then got stuck that way. So training is done on involving or running into these circumstances at all times, because a lot of the things that they do afterwards, after having exposure, is going to be that you report it immediately or at once, and that then you have to have labs drawn, and so does the patient, if you can figure that out as well. Okay? And it's typically not just like one time, but they have to go back and kind of get reconsulted and read labs drawn and so forth. One example of a thing was that HBV, and so what that's standing for is hepatitis B. Okay? Hepatitis B is kind of a thing that's kind of went out the wayside, but it's because we're all vaccinated against it. Your vaccines for hepatitis B started when you were an infant. Mine started when I was in 7th grade. It's a series of 3, and my students, when I first started here, the first 4 years, I was 7, so not that long ago, all my students had to have a tube of blood drawn by the lab. Okay, so on top of all this other stuff, they used to owe $90-some in fees, not 72. And they had to have a lab come and draw labs for an hepatitis B titer. And so since it's decreased so much, the CDC said we could back off of that. Okay? But one of the things with hepatitis B, who it usually spreads to is healthcare workers and so forth. So they want to make sure that before you start working at the workplace that you don't have it. Okay? So you really should wear your personal protective equipment, and that's going to include and cover your undergarments, your skin, your eyes, your mouth, and your hair. Okay? Watch for any splashes or anything like that. And your PPE should always be free to staff members, okay, and students. You need to check for correct sizes, and if they don't have those, then you should ask them to order them for you. Contaminated equipment is cleaned and then decontaminated with a proper disinfectant. So at the hospitals, it's not really Lysol wipes. There's some wipes that have a purple lid on them. And if you use them, which you should always wear gloves. Okay, always wear gloves. They are more of a disinfectant than Lysol or Clorox wipes. They got some bigger chemicals in them. And so they can really hurt your skin a lot and so forth. But so properly disinfecting in between patients is going to be essential. One of the other special measures to make sure that we don't get any sticks or pokes or get blood exposed to us is getting rid of our items that have this on there. And so how we get discard things is going to be through biohazard containers. So an example there in picture A, the clear container, the red container, and then B is going to be an at-home person that's using insulin, but they're using a thicker plastic container to do that, and then it is labeled correctly. Okay, so those containers are meant for us. If you get things in there quickly, and then they go to a different trash than just the regular trash that people pick up and so forth. Because, you know, have you ever seen the trash picked up? I know mine's way early in the morning. I hardly ever see it. But those people sometimes have to touch it even though they have gloves and so forth on. Okay? When there's an incident that happens, it could be in the eye, the mouth, other mucous membranes, non-intact skin, or in parental area contact with the blood. Okay? Parental means within the mucous membranes. You should report these things immediately or at once. Confidentiality with these is so important. And the source is the individual or person whose blood or body fluids are the source of the exposure incident. You're going to have a medical evaluation, meaning labs and visits and so forth for quite a while, and then you should have a written opinion of the medical evaluation 15 days later. Moving on from medical asepsis to surgical asepsis. So this is called sterile technique as well. Sterile technique is something that you guys as CNAs are not really responsible for. You could be assisting with it, but not doing it. Medical asepsis you could definitely do. Sterile technique, you can assist with it, so we go ahead and teach it to you, but you're not allowed to insert any tubes or anything like that that require sterile technique. Sterile means completely, the zero, the absence of all microbes, including the spores. Sterile technique is required anytime the skin or tissues are going to be entered. Okay? If a break occurs during sterile technique, the microbes can enter and infection is at risk, and that is contamination. So I am going to show you in the lab today a sterile gloving. You're not going to practice it because you guys, like I said, you're not actually going to be doing it. You could be assisting with it, but not doing it. Okay? So, principles of surgical asepsis, sterile field is needed. Before putting on sterile gloves, the sterile field has to be set up. After sterile gloves are on, you can handle sterile items within the sterile field, and you do not touch anything outside of the field. So this is how to put them on, and I'm going to show you this in person, and so forth. All right, so we're going to move on to the next chapter, chapter 17. And this one has to do with the isolation precautions. And so that means what we're going to wear PPE-wise, how we're going to take care of those biohazard containers and so forth. And I don't feel like the next two are very long. Sorry, I'm going to stop and shake a drink real quick. Not very many of you guys said that you had to wear PPE last year. I know some of the places you were at just for like a day or two. But that kind of surprises me, especially since we go to clinical in the winter months. That's when the PPE really increases because there's a lot more flus, viruses, and things like that require PPE.
Last year I was in the kitchen 4 different times.
4 times? Gotcha. I know at Mercy in the Kitchen, one year my student made cupcakes. I'm like, holy smokes, they like decorated them. I'm like, well, that sounds actually not that bad. I would enjoy it, but maybe they didn't. Did you stock?
I stood there.
Oh, you didn't stock or anything?
Well, I stopped like once.
Oh,
And the rest of the time I just stood there.
yeah. Listen, this year at Clinical, you don't have no downtime, okay? No downtime hardly at all. You're working pretty much the whole time you're there. The afternoon is a little bit different in that sometimes it's hard for the morning CNAs to hold back on the showers and leave you one, and so forth, but you don't have near the downtime that you had last year, or the not doing there and standing there thing, okay? This is doing more than anything, all right? So blood, bodily fluids, secretions, and excretions can transmit pathogens. Sometimes barriers are needed to keep pathogens in certain areas. So these barriers could be a gown, it could be a mask, it could be goggles or eyeglasses or something like that. Isolation precautions are based on clean and dirty. This is a pretty common sense concept, but I feel like it definitely does have to be explained, okay? Clean area or objects are free of pathogens, where dirty area objects are contaminated with pathogens. Clean and dirty also depend on how the pathogen is spread, and there are 2 different groups of precautions that we're going to have to take. Standard precautions are going to be the everyday precautions that you use. The hand washing, once your hands get soiled, that you don't do the foam sanitizer anymore, that you do actually wash your hands, where transmission-based precautions are based on the disease process and what is going on with the patient. So, these are just all the different things under standard precautions. They're used across the board all the time. Standard are just standards of care that you should practice. You should always be doing this to prevent the spread of blood or all body fluids, non-intact skin, or mucous membranes. So this is like when we wear gloves or just so forth or practice normal things. Within protective measures, if we have to wear PPE, this is one example of a room outside the room that there's this nice closet. I've never seen that before, right beside it, where it keeps that PPE. You're most of the time going to see a cart outside of the room, and then you're going to get the stuff out of the cart. If you needed to take a drink, oh, you got a drink, all right,
Yeah.
you're fine. Some bags require double bagging if they're wet on the outside. Double bagging is pretty self-explanatory. You just put a second bag around it, okay? Hey, don't throw away that bottle before you leave today. I need it for something, a project.
Wow.
Yeah, I know. I'll tell you later. What?
She's gonna take your saliva on that one.
No, I don't.
Wait, what?
Anyways,
Yeah.
I'll tell her later what it's for. Follow agency procedures when collecting specimens and transporting patients. If you're transporting a patient, say down to radiology that's in a certain room with precautions, then they're probably going to have to wear this stuff when you transport them, like the gown, the gloves, the mask, okay? Gloves you need to wear whenever contact with blood or bodily fluid secretions, excretions, mucous membranes are likely. So, should we wear gloves when we do blood pressure on a patient?
Yeah.
I don't honestly think that we do need to. We really, when we're doing blood pressure, are not coming into contact with any blood or bodily fluids. No. If the patient is super sweaty or you end up doing something else, then you end up handling urine. If you have to do something else, then you could potentially have to put gloves on pretty quickly. But if you're honestly just doing blood pressure, you don't have to wear gloves. You still need to use hand sanitizer before leaving the room or right after you step out in between patient care, but you don't have to wear gloves. Gowns are going to protect your clothes and your body from contact with blood. They should go from your neck to your knees. They are only used once. They are thrown away and discarded after use. Masks are worn for protection with contact and infectious materials from the patient. Also during sterile procedures from anything carried in your nose or your mouth. There's also a special tuberculosis mask. You will not ever have to go in a tuberculosis room because you're not fitted for the N95 mask. And so you won't ever have to go in those, and neither will I, and it is very rare. I think I've seen a possible tuberculosis case once in my career. Once. So, goggles and face shields protect your eyes, mouth, and nose from splashing or spraying of blood. So if you think you're going to be in that scenario, then you should have that as well. Contaminated items like that are in the bag need to be removed. We should use leak-proof plastic bags, but also there are some bags that have the biohazard symbol, so those are going to get those bloody towels, bloody substances, and so forth. Trash is placed in a container labeled with the biohazard symbol. Double bagging is needed if the outside of the bag is wet or soiled. And just follow the place's policy. One of the first things I like to do with students when we get to clinicals, whether I'm there with you your first day or your second day, is kind of just orienting you to the floor, showing you where the dirty linens go, showing you where the clean linens are, showing you where the supplies are. Does that make sense? And we'll go around, we'll ask the staff, hey, what's the code for this, and so forth, for this room for us to get into the clean and dirty supplies. All right, one of the problems with patients being on isolation or having to wear PPE into their rooms is that they often are feeling like down low. They're having problems with the basic needs like love, belonging, and self-esteem, okay? So please don't complain about the gown being too hot while you're in there and stuff like that, because guess what? It is hot, you're sweating, you're drenched in sweat maybe, but they are feeling just as guilty that you're having to wear it than you actually being in it, okay? So treat them with respect, kindness, and dignity, and just know that we're doing it for everybody's safety, okay? So this is how we practiced before, putting on the gown, the mask, and the gloves, and then taking it off is going to be the opposite way. The gloves, the face mask, the gown, and then the mask. Yes, same thing. And then we are done with chapter 17. I'm going to pause my video here. We're going to go on a break, and please return at 5 till 1. All right, chapter 18, body mechanics. So, what's body mechanics? Anybody know?
The way your body like works.
Close. Body mechanics, it is kind of the way that your body works, okay?
Mechanics is like how your body moves.
Just move on.
Yeah, just
So the way your body moves, but we want it to happen in the correct way and not get you hurt. So we need to practice proper body mechanics so that we don't get hurt at work. These chairs were supposed to be designed by an ergonomist who in ergonometry, they study like the patterns, okay, or to keep you in good posture, all right? So Body mechanics means using the body in an efficient and careful way. It involves good posture, balance, and using your strongest and largest muscles for work. These things all reduce your risk for injury at work. Body alignment. Not only is this good for us, though, while we're doing stuff with patients, but also we need to keep this in mind when positioning the patient. Do they look comfortable? Are they straight? Because if they're not straight, they're going to call out in 10 minutes and say, I'm not comfortable. You're going to have to straighten me out.
There was a
So.
patient at Pike that wanted to get changed like every 2 minutes. Like they would sit in one position. Next thing you know, call light went on or whatever.
Mm-hmm. All the time, right?
Yeah.
Yeah. So, another thing, the posture is going to be the way that your head, your trunk, your arms, and your legs are aligned with each other. Okay. The base is going to be the support area where the object rests. So if we widen our base, meaning that we stand with our feet wider, that is going to help us in balance and support. Okay. So you should use your strongest and largest muscles in the shoulders, upper arms, hips, and thighs to handle and move patients and heavy objects. Has anyone ever worked somewhere where they say, bend at your knees? You lift up heavy objects. They want you to lift up a box with your knees, not with your back. If you bend over every single time and pick up a box like this, you are straining your lower back. You are straining your lower back. You have to bend with your knees because you're using all of your leg muscles and not your back muscles, which can get injured very, very easily. Okay? So you need to use your strongest and largest muscles. Okay? So use your feet, stand with them apart, make a wider base, and so forth. So this is going to be an example of standing there with good posture, with a wide base, and then picture B there is going to be bending at your knees to get the box instead of bending over. Okay? Ergonomics. This is the science of designing a job to fit the worker. Okay? The goal there is to eliminate like any serious injuries or disabling work-related musculoskeletal disorders. It involves changing the task, the workstation equipment, and the tools to reduce stress on the worker's body. Have any of you guys ever worked somewhere or known anybody work somewhere that they have to stretch at the beginning of their shift? Anybody work at manufacturing pretty much at all? Manufacturing is going to be those factories. In the summer after I graduated, I worked at a factory, and we had to be there at 5. We had to stretch every morning. It was a have to. They had us on camera. If we did not, then we could never sue them for being hurt because we didn't get our stretches in. Okay? And so we had to stretch. It was a thing you had to do every day because otherwise we stood in the same spot and did the same little thing, or we made the same motion depending on what machine we were on all day long while we were there. Okay? So when you work in manufacturing, a lot of times they have you stretch. I think Walmart wants you to stretch technically beforehand, somebody said, or you're supposed to. So you're supposed to, or you've signed off on something saying that you've been educated on it. So then if they ever get sued by employees for injuries, they say, well, did you stretch like you were supposed to? And so if you didn't follow the things that you were trained to do, then it's more negligence on you than them. Does that make sense? Yeah. So OSHA. We talked about OSHA last week with material safety data sheets, but they're also in charge of workplace safety. Okay? They identify these risk factors for nursing team. So they identify force, which is the amount of physical effort needed to perform a task, repeating an action, which is doing the same motion or series of motions continually or frequently, awkward postures, assuming positions that place stress on the body. Okay, sometimes when we are doing patient care, we might be put in an awkward posture or anything, any job or career path. Okay? But these musculoskeletal disorders are more likely to, if risk factors are combined. If you're doing multiple ones of these things together, and if you're using both force and repeating actions, then you really have a risk for hurting your body at work. OSHA requires a safe work setting, so places have to attempt to prevent or reduce the hazard of workplace injuries. Back injuries are going to be the #1 problem more than anything, okay? Signs and symptoms include pain when trying to assume your normal posture, decreased mobility, pain when standing or rising, reaching while lifting, poor posture when sitting or standing, twisting or bending, and fatigue as well. So now we're going to move on from not only taking care of yourself as the provider, but also keep in mind the patient. So we're going to learn about some different ways to, or shapes and types of ways that we should be positioning our patient, because if the position is not changed on the patient every 2 hours, then we have to do it for them. So the patients that are in coma or that cannot move their body on their own. Position changes and good alignment in the bed promote comfort and well-being. They promote breathing, they promote circulation, and they help prevent pressure, injuries, and contractures that we're going to be starting to work with next week with A&P, or tomorrow, not next week. Patients and residents may move and turn in bed or a chair without assistance. They might need reminded to change their position. They might need help with position changes, or they could depend entirely on the nursing team to change them for position, okay? If they depend completely on the nursing team to do that, then it is required by law that we move them or reposition them every 2 hours, okay? Even if it's just a little move, it's a move and it has to be documented. To safely position a patient, you should use good body mechanics yourself and for them. You should ask a coworker to help if needed. A lot of times you do. Explain the procedures to the patient. We're going to reposition you now. Is there a side that you would like to be turned on or a certain way that would help make you comfortable? Or we're going to help you get up to the chair for a little bit. It's time to eat breakfast, would be a good idea. The chair is always good if they can do it to get up and eat. Okay, that's a change of position. Provide for privacy. Be gentle when moving the patient. Use pillows. We use a lot of pillows. Okay. Provide comfort after positioning. Give them their call light. And make sure and do a complete safety check before leaving the room. A big safety check before leaving the room is going to be making sure that bed is put down in the low position before leaving. This slide here is going to explain the different positions you can put a patient in bed. So one of the first ones here is going to be the Fowler's position. And it says on here, the head of the bed is raised 45 to 60 degrees. Well, you might not really remember what that is, but I'm going to show you in the lab where 45 to 60 degrees is on the bed because it actually says those numbers, okay? And it's important that you know that for your CNA exam. Your knees could be slightly elevated or the patient's could be in the Fowler's position as well. In supine position, the patient is laying on their back, okay? In the prone position, this is how a lot of people sleep, including myself, are on their stomach. The lateral position is the sideline position. And then the Sims position is also how a lot of people sleep, is the semi-prone side position. So they're laying on their stomach, but they probably have like some of their body up, okay? So let's look at a picture of these. Fowler's is the first one. Supine is the next one. Prone, lateral, which is on one side or another. And then a Sims is going to be a mixture of both. In the lab, I would like you to do Fowler, supine, prone, and lateral, okay? The chair position. The person in the chair must be able to hold up their upper body or their hands erect, okay? Heads is what I meant. So their head must be able to hold up on their own. Their feet need to be on the floor and their wheelchair foot plates. But if their kickstand is up, then their feet and legs can be under that. We might just recommend a pillow underneath their legs, okay? Also, if you're in the chair, there's a chance that we're going to put a small pillow behind the patient's lower back, and that kind of helps. The chairs are super uncomfortable, especially in the lower back area. Some people require postural supports, which could just be more pillows that kind of keep them up straight and so forth as well. All right, so this is going to be a proper body mechanics video, and this is it.
Body mechanics. Back injury is one of the greatest risks that healthcare workers face. By following the correct principles of body mechanics, you can greatly reduce the risk of injuring yourself on the job. The first thing you need to remember is that we're healthcare workers, not superheroes, and we can't be expected to lift 300-pound patients on our own. You have to advocate for yourself